Good evening. I am Paula Fontana, Vice President of Strategic Programming Initiatives with the National Black MBA Association, and it is my absolute pleasure to welcome you to Becoming Trinity Health Board Ready. This is an exclusive Gold Key Access opportunity. So the National Black MBA Association created Gold Key to connect our members seeking director level and above roles with sponsors. And so tonight's session is all about access. The exposure and the advanced thinking derived from sitting on a board is invaluable. And so I am so pleased that Trinity Health is here this evening to expose you to this opportunity. And I know they have quite a bit of information to share, so let me get right into introductions. So first we have LaRonda Chastang, Vice President of Diversity and Inclusion. She has over 20 years of experience leading change in diverse environments. She is responsible for developing and leading the National Diversity, Equity, and Inclusion Strategy in alignment with Trinity Health's mission, vision, and core values. LaRonda has held leadership across diverse sectors that have developed her into a strategic thinker, a flexible leader, and a genuine influencer. So we are happy to have her. Next on the slate is Gina Bono, Vice President Governance, and she is responsible for setting the strategic agenda for Trinity Health's governance function, as well as the Office of the CEO. She provides assistance and support to help Trinity Health's board achieve its goals and works to improve relationships between the board, the Trinity Health management team, and other constituents. So I know she has valuable information to share with you. And then last but definitely not least is Tanya Morris. She is a consultant with Trinity Health's Office of Diversity and Inclusion and helps develop, lead, and support the organizational diversity and inclusion platform, initiatives, and strategy system-wide. She helps advance the diversity strategy of Trinity Health by working to enhance the effectiveness of their colleague resource groups, diversify board compositions, and partner on various projects to improve health outcomes and achieve racial equity. Ladies, welcome. Take it away.
Great. Thank you so much, Paula. Again, this is Gina Bono, and I'm just thrilled to be with you this evening. And we have some really exciting information to share, and we certainly are very open and eager to hear your questions and anything that you would like to know about Trinity that we are not covering today. But before we get started, I would like to share, we have a message from our CEO that we would like to put up here for you. One second, sorry. It's coming.
Well, hello, and welcome to Trinity Health's Becoming Board Ready webinar. And thank you for your interest in learning more about Trinity Health. You know, Trinity Health is one of the largest Catholic health systems in the nation, serving more than 30 million people in diverse communities across 22 states. We have 117,000 employees that we call colleagues, 91 hospitals, 17 clinically integrated networks, over 100 continuing care locations for seniors. We're the second largest PACE provider program in the country. We have thousands of employed and affiliated physicians, over $1.3 billion in annual charity care and community benefit spend. 1.4 million members as attributed lives in our accountable care organizations, and $19.4 billion in annual revenue. Our mission, values, and vision speak to our aspiration to be a compassionate and transforming healing presence within our communities, and to be the most trusted health partner for life. We have 6 core values, including reverence, justice, integrity, stewardship, safety, and commitment to those who are poor. Trinity Health is committed to enhancing diversity and inclusion at all levels within our organization, including the ethnic and gender diversity of our national system and our community health boards of directors. Having a diverse organization is a central part of our mission and strategic plan. It's our belief that the more ways we have of seeing and thinking about the world, the more likely we are to identify opportunities for transforming healthcare and delivering equitable healthcare to all those we serve. Diversity, equity, and inclusion are strategic priorities for our organization, and we consistently work to embed them into our DNA, including board recruitment, advocacy efforts, clinical decisions, community engagement, employee recruitment, retention, and advancement. We know that concentrating on only one form of diversity, like gender, isn't enough. We also believe that social diversity, including race, age, and diverse faith traditions, as well as having a range of professional skills and expertise, are also important for increasing diversity of thought perspectives on our boards. By elevating different voices, contrasting insights, and varied perspectives, we make our organization more effective and reflective of the communities we serve. Next, I want to share why this is important to me from a personal perspective. While I was committed to our quest for diversity, equity, and inclusion before George Floyd's murder, that event was a defining moment in my life's journey of truly understanding systemic racism. So many of our employees and board members poured their hearts out after that event, creating a rude but necessary awakening for me. And not only have I continued my learning journey from that point, but it raised the question of how can I, as a leader, walk the talk? It's reinforced why our healing ministry must take bold steps to change the status quo. Changing the face of governance and leadership in our organization is an important step forward. So thank you for letting me share the Trinity Health story and my personal story. I appreciate your taking the time to participate in this webinar today, and I'm excited about what the future holds and hope that this program piques your interest in Trinity Health and potential opportunities to engage with us. As a faith-based organization, we're committed to advance the common good for all the people and communities we serve. Peace to you all.
Okay. Can everybody see my slides again? Great. Okay, so before we get started, we'd like to just ask a chat question, and we're just really interested in where each of you are calling in from. So if you could just in the chat, just put for us so we can get a sense of where you are, that would be great. Having a little trouble.
I got to unmute myself and say, hey, William. I don't even know William, but he's from Detroit. So I had to unmute myself and say hello.
Anybody else? Because I'm not able to see my chat for some reason when I try to pop it up. So
from all over the place. Gina, we got DC, Atlanta, Maryland, Georgia, New York. Where else we got? I missed somebody. I missed quite a few people.
Okay, and this is
Charlotte.
Gina. I don't see your screen. I just see like a blank, so I'm not sure if everybody else is seeing your screen.
It's still on Mike's video, Gina. So if you advance
is.
one,
Okay,
it's the end of his video. That's all.
okay, hold on. Let me try
Yeah,
it again.
Texas checking in. Let's see who else.
Oh, and now I see it. Okay, I'm gonna share it again here.
Okay, let's close that.
Can you see who we are? Slide now?
Yeah,
Okay.
we can see it now. Thank you.
Okay, wonderful. Well, welcome everybody again. Just we're delighted to be here today. And so we will share a little bit of information about who we are as an organization, go a little bit over what our governance structure is and what our boards are looking for when it comes to recruiting board members. And then we will kind of provide an overview of our commitment to diversity, equity, and inclusion. And so just to kind of get us started, to get us grounded, we actually share this slide in every presentation that we give anytime we're even internally or externally, is we focus on our mission, vision, and our core values. And Mike shared a little bit about this in his video, but it is who we are, it's how we serve our patients, our colleagues, and our communities. And we focus on our values. And just this last year, with everything that was going on related to COVID, with racial unrest, we made a strong commitment and added a core value in the last 18 months or so of safety. And so we'll talk a little bit about that as well. And this just kind of gives you a visual of where we are located across the United States. We are in 22 of those states, and we have over 117,000 colleagues. And so we are in a very wide range. In each of those areas, we do have a number of boards and communities, and we will share a little bit about what that looks like. But we are one of the largest Catholic health systems in the nation. This is our executive leadership team, and it includes, you can see at the top is Mike Slabowski, and then his executive leadership team is those responsible for all the major system function across the organization. And then in addition, our system officers are our health ministry CEOs, and that's at the bottom half of this page. And they are those executives that have regional boards that are part of our governance structure, and they lead all of the 22 hospitals plus our physicians and colleagues in nursing homes, et cetera, across the system. Over the last year, as we were in the middle of the pandemic, one of the things that the executive leadership team is focused on putting together a Together Health 2023 strategic plan. And there's 4 areas of focus within the strategic plan: purpose, people, performance, and portfolio. And you can see that underneath each of these areas are our areas of focus over the next 3 years. And we are obviously in the first year of that right now. So focusing on, as an example, eliminating racism. Culture is very important to us under people. Portfolio, so expanding our system into new health segments. Ministry, development, and growth and innovation is very important. And then under performance, overall financial performance, zero harm, which is again focusing on safety, and systemness, which is continuing to evolve our operating model as a health system. At the bottom is our brand. We listen, we partner, and we make it easy. And you'll see that in all of the things that we cover as part of our system. Just wanted to briefly provide you a quick highlight of our priorities over this next year. Our fiscal year is July to June, so we are in the first month of our new fiscal year, and just wanted to provide you kind of an overview of the areas of focus. So just to highlight a few, digital platforms and experience is one area, as you know, within the healthcare industry and across all industries, really, digital is very important and critical, especially as we've had to learn to operate differently within the pandemic. So a lot of focus on that. Nursing recruitment and engagement. You know, there's been a lot of changes over the last year, 18 months related to what we need to do in recruiting and retaining the nurses that we have, again, as a result of the pandemic. And so not only from a nursing standpoint, but also an overall engagement model and keeping them engaged. Safety, zero harm again, and then culture. So now I'd like to shift a little bit into the governance. And before we get started, wanted to just again, if you wouldn't mind, to put in the chat, if you are currently on a board, what kind of board are you serving on and in what industry? Just so we can get a feel for what kind of experience that you have. I'm looking to see, is there anyone that has any board experience? Serving a publicly traded board in the buildings industry, great. 2 boards, environmental organizations, great. Board of a federal credit union, board of the School of Business, and a couple others. Great, thank you for sharing. Just it helps us to kind of to get a feel for, you know, what areas of focus that you are in, and then how we can maybe cover some of the things that would be interesting to you if you are interested in serving on a board. So moving into the governance section, I just wanted to start out by introducing you to our Trinity Health Board. This is the board of Trinity Health and Catholic Health Ministries. I'll explain a little bit about what Catholic Health Ministries is. We just recruited 3 new board members this year. We have a very diverse board that includes executives that have been in various leadership roles, whether it's a CFO or a CEO. We have physician, we have nurses, we have, you can see several sisters that represent our organization from a Catholic faith-based organization. And so, you know, as we do with our boards at the regional and local level, we are committed to having a diverse board that serves at the system level. And just wanted to give you a little bit of context on how we are structured. Trinity Health is an Indiana not-for-profit corporation. It is a 501c3, so it is tax exempt. It was formed in 2000 with the merger of Mercy Health Services and Holy Cross. And then again, was expanded in 2014 when Catholic Health East merged into the organization. And so you can see we have Catholic Health Ministries, which provides the oversight of the organization. It is a public juridic person, and I'll explain a little bit about what that is. It's very unique in healthcare, and particularly in Catholic healthcare. The relationship to the church is something that makes us different from other organizations, whether those boards that you sit on now or other health systems or other corporations. Catholic Health Ministries, because of its Catholic nature, our board at the system level is required to be a majority Catholic. It is not required at the regional and local level that we have Catholics as part of our board, but we do certainly have a strong tie with the Catholic Church. And in fact, as part of the responsibility of our system, we actually report into Rome. And each year we actually, we have to put together a report that we actually send into Rome to provide an overview of the things that we have done over the last year, sharing a little bit about our strategy, our financial performance, and each year they actually they review it and provide us a kind of an acceptance that we are in line with following the Catholic faith tradition when it comes to our organization. Wanted to take a few minutes to talk about, the reason that one of the reasons that we wanted to connect with the association and share a little bit about Trinity Health is, we continue to strive to have all of our boards diverse, not only from a diversity and gender perspective, but also from a skills and experience standpoint. And so each of our Trinity Health board members, whether it's at the system level or at the regional or local level, we look at a number of things when we are doing recruitment. And you'll see here there's a number of roles that we ask our board members to play. And it goes everything from being mission driven to supporting our organization from an advocacy standpoint, having them grounded in spirituality, whether it be any faith tradition that that they come from, but having obviously the honoring the fact that we are a Catholic faith-based organization, and certainly stewardship and focusing on strategic vision and innovation. And then the other component that we look for when we are recruiting for board members is that that we have a balanced board that kind of falls into having some of these characteristics as part of what they bring to the table, so to speak. So within our boards, again, whether it's at the system level or at a regional level, we want to have a balance, and whether it's they come with technology and innovation, systems management, business, philosophy, ethics, theology, maybe it's population health. We want to make sure that we have those areas covered, because we believe that is what it takes to best serve the organization from an overall standpoint. And so what you'll see here, and this is just a representation, each of our regional boards, we actually ask them to kind of provide an overview of the board, so we can capture not only the age, but their faith tradition, their gender, diversity, and then we can see where each of the board members are from a knowledge and experience standpoint. So you can just see that, as we do our recruitment each year, and we do appoint new board members at each fall for a term that starts in January. This is a tool that we use. And then just before we shift a little bit, I want to just provide you a little bit of an overview of the types of boards that we have and what the opportunities to serve are. And there are many. We have, and there's, we call them in different tiers. So I wanted to give you a little bit of a flavor of just the number of boards that we have. If you recall on the slide where we talked about the Ministry Leadership Council, so we have the CEOs that represent the regions. They provide kind of the leadership for a number of first tier ministry boards, and that's this 15, and it gives you kind of an overview of where those are located. Those are at the ministry level. Those are the health systems and hospitals that have regional boards. And then we have underneath each of those large regional ministry boards a number of what we call second tier boards. There's 21 of those, and those are local boards that roll up to the regional boards. So again, a wide variety of opportunities there and in various locations. We also have boards of not hospitals, but other types of large organizations. We have a board that covers the PACE program. We have our home health, Trinity Health at Home. It's our continuing care services, and then senior services. So each of those have boards. And then we also have a section we call Mission Health Ministry boards. So that is another unique for our organization, where it's actually those that are foundations. They serve those that are underserved in some of the communities that we provide care to. And so again, many opportunities. And then this just gives you a sense of, from a regional and local perspective, just where those all are. So you can see, we go from everywhere from Boise to California over to Florida and into the New York area. And then with that, I will turn it over to Tanya to provide a D&I overview.
Thank you. Thank you, Gina, and good evening, everyone. Again, my name is Tanya Morris, and I'll be giving a brief overview of diversity, equity, and inclusion work at Trinity Health. Next slide, please. Okay, so in 2017, our Office of Diversity and Inclusion, along with our executive leadership team, began building a system strategy and framework to support a diversity and inclusion infrastructure within our organization. A 5-year strategic plan was created that identified 5 work streams, as shown here, as priorities for increasing diversity system-wide. They include increasing diversity in governance, increasing diversity in talent, ensuring an inclusive and culturally welcoming environment for patients and colleagues, increasing supplier diversity efforts, and eliminating health disparities. Next slide. Next slide, please. Thank you. To increase diversity in governance, we want our boards to be reflective of the communities we serve. With diversity in talent, we want to have a diverse colleague base that, again, reflects the demographics of the communities we serve. In creating an inclusive and culturally welcoming environment, we want to ensure our patients and colleagues feel safe, included, and welcome. With supplier diversity, we want to diversify our vendor and supplier base by economically supporting the communities we serve. And we will work to eliminate health disparities and achieve health equity in the communities we serve. Next slide. So in the past year, we incorporated 4 priority actions to address and help end systemic racism. Our CEO, Mike Slabowski, spoke a little bit about how he was impacted post George Floyd. And one of his first actions was to identify for Trinity Health to advocate for racial justice. He immediately declared racism as a public health crisis and began implementing programs and activities to address the racial disparities of COVID-19 in communities of color. His next priority was to review and update all of our HR policies and practices in an effort to create more equitable compensation and talent management processes. We also decided it was important to reinforce a culture of inclusion. We're doing this by implementing a mandatory annual cultural proficiency training for all colleagues and providing de-escalation training for all security personnel. Finally, we have prioritized support through stewardship with the goal of achieving a 50% spend increase with diverse suppliers over the next 3 years. As a Catholic Health Ministry, our commitment to diversity, equity, and inclusion is strengthened with our partnership with the Catholic Health Association. We have joined their We Are Called pledge and have committed to immediate action to achieving COVID-19 health equities by engaging communities of color through hosting educational town halls and webinars, providing COVID-19 testing and vaccinations, and utilizing telehealth capabilities to increase overall access to care. In alignment with our 4 priority actions to address systemic racism, we will continue to review our business practices and hold our leaders accountable toward dismantling racism and inequity. We'll continue to build right and just relationships within our communities and continue to leverage our voices to advocate for change, to end health disparities, and achieve health equity. Next slide. Okay, so earlier I spoke about our strategic plan with our first work stream or focus area being to increase diversity and governance. And we plan on doing this by implementing a national approach to support diversity in board governance, providing diversity, equity, and inclusion education for current and future board members, and building relationships with national and local organizations such as the National Black MBA Association to enhance the diversity of our board candidate pools. Next slide. Okay, so a little bit of data to share. From 2018 to 2021, we have seen an 8% increase in the ethnicity of our health ministry boards. Looking at the table here in the column showing Black African American, we went from 12 to 17%, a 5 percentage point increase. Hispanic and Latino from 6 to 8%, and Asian from 4 to 5%. So there's our 8% total increase. And we also had a 4% increase in female representation, which went from 40 to 44%. Next slide. This slide speaks to representation increases in board members of color on the Trinity Health Board. Over the past 4 years, we've seen a 9% increase in board members of color. And so while we've made progress with board diversity, we want to go further and really implement strategies to expand and diversify our board recruitment efforts. And that's really why we're here with you this evening. Next slide. Next steps. I'll turn it back over to Gina.
Great. Thank you, Tanya. So, so next steps, we wanted to, again, thank you for joining this evening so that we can provide you an overview of who we are and what opportunities we have within governance as we look to do recruitment over the next year or so. And next month, we are scheduled to have a focus meeting with those of you who are interested in becoming potential board members within our organization, and want to set that time aside to answer any specific questions that you may have about opportunities that exist. And then from there, we would like to, in October, schedule focus sessions with those who are interested and the leaders of the ministries that we have across the system, so that you can get to know them and they can get to know you and answer any specific questions you may have. And with that, I think we can open it up to Q&A.
That's the next slide.
Yeah. What questions can we answer for you? Anything unclear? Is there anything that you would have liked to heard that we did not cover?
I think they're coming through in the chat, Gina.
Yep, just so time commitment for board members. It does vary. I will say that most of our boards are meeting quarterly. We do have a few boards that meet a little more often, but from a standard, we are trying to move everybody to a quarterly board meeting. And then, so that's the prep time and then the actual commitment of quarterly board meetings. Is it age limit? No, there is not an age limit maximum for board members. Just a little bit about board appointment that I can share too is we do have a term limit where board members can serve up to 3 3-year terms. So 9 years total is what we support for the organization. Is there an interest? Yes, absolutely. Legal and clinical is critical within our boards. And so very important for that from a skill set standpoint to have legal and clinical background. And not only at the regional level, but we also have committees of each of our boards and focus on quality and clinical areas of focus. So it'd be really important for that. The board positions are not paid. The only ones that are paid is our system board. They get a stipend, but all the other boards are at the community level, and they are volunteer positions and do not get paid. Oh, wonderful. A patient at Holy Cross. Great, Marvin. Well, we look forward to talking to you more. Trying to see if I miss any. Opportunity to serve on committees, is that separate from board membership? So it can be related, but we've also been exploring the opportunity for people to serve on the committees as a way to start getting engaged at our ministries and serving on a committee. So we would love to be able to meet with you and talk with you so that we can talk more about what opportunities may exist at the community level as well, and what committees you could potentially serve on. Let's see, what else?
Is there a financial commitment?
There is not a financial commitment. I guess a clarifying question, but there is not. We do not require our board members to do specific fundraising or provide a certain amount of money. There is nothing that is required as part of your membership from a financial standpoint. So the process to be placed on nonprofit versus corporate board. So the process for our boards is, so each year our ministries, each of our boards have boards, and there's people that are rolling off each year. And so as they look at the, as I showed you the matrix of the skills and competencies within the board, they will look for areas that they need, whether it be from a skills, knowledge standpoint, diversity, gender, et cetera. And so one of the ways that we would like to connect is to be able to know those of you who are interested, so we can have the opportunity to meet you and see what interest there might be, and then that way we connect you with that. And so as part of their recruitment process, they can determine if there's a need now or sometime in the future. And we do recruitment actually all of the time. We have an annual process where we do the board appointments for the January cycle, but there's always the opportunities to do it off cycle, as well as a board member may need to resign for one reason or another, or sometimes boards have been holding off on filling their positions so they can find the right board member to sit on their boards. Application process. So you do not have to be located in one of the headquarter locations, but I will say that in general, people that serve at the community level are within the community. We do have some large regions. So like in the Mid-Atlantic region, we have several states that are represented there. So you don't necessarily have to be in, you can be in any number of those states. And then within, like, we have a Michigan board, and that is for the state of Michigan. So that's, quite a diverse area that you can be from to serve on a board, as an example. It's the CEO and the board chair, and this will be something that we will facilitate in October for those, after we've had the conversation in August. In October, we would like to connect you with the CEO and or board chair within those regions so that they can get to know you a little bit better. And then that's where the formal process would begin, as far as if there's an opportunity, and then the interviewing to be able to potentially sit on a board or a committee. Make sure I haven't missed any. Great questions, my goodness. Trying to keep up. What other questions can we answer for you now? I know it's a lot of information that we shared, and certainly available to follow up on anything that may come up. I understand there's a survey that will be that you will get, that you'll be able to complete, and then you can ask any additional questions there, and we can certainly reach out to you to clarify anything. So the process from this point will be that after this session, Paula will work with us to determine who are those that are interested and want to learn more. And then we will engage with you in the August session and ask and answer any additional questions that you have. And then from there, we will connect with our ministries to share those interests with them, so that they can then determine where that may best fit, and then follow up with you. Express interest through the survey or through, I think, Paula directly. Either way would be great. Certainly would hope to see you in August if you were able to attend that session. Will I reach out to all the attendees of this session? Paula, I think that might be a question for you.
That was where the question was. Oh, yes. So attendees will all get the survey, as well as get the information about the webinar so that you can see it afterwards in case you want to review any of this amazing content that has been presented today. Any more questions? Going once. Going twice.
Invitations be sent for the August session, Paula?
Yes, so once you've gotten a survey and expressed your interest to move on to the next level, then you will get an invitation for that session as well. So be on the lookout, Rhonda. Thanks for the question. And thank you, Trinity Health, for this amazing session. Definitely very thoughtful. Love the variety of opportunities. So for all of you watching, I definitely encourage you to express your interest and move on to the next level, because it really will open your thinking and allow you to share your amazing talents and gifts with this organization. So we absolutely want to hear from you. I mentioned the survey a couple times. So let us know how this was. Did it resonate well with you? So you will see a survey pop up in the survey link. So the first 25 people to register and fill out all the information for this survey will have a chance to win an Amazon gift card. So you want to be one of the first people to fill out the survey in its completion. Again, thank you so much, Trinity, for your time. Thank you all for your attention, and I hope you have an amazing rest of your evening.
Thank you.
Thank you, everyone. It's been
Have
a
a good evening.
pleasure.
Thank you so much.
Have a good night.
Bye-bye now.